Hey guys, welcome to this video. My name is Jonathan Trailer. I'm the host of Hope with Jonathan podcast. And on this video, we will be talking about why it's important to know what kind of meds to take whenever you have a fever, especially with battling COVID. And so, with my experience with battling COVID, I wanted to talk a little bit about what I took when I was suffering with COVID and the Omicron virus. If you guys are here for that video, stay tuned to that for this video. I want to share just a little bit of information and a little bit of background about who I am. So if you're new to this channel, my name is Jonathan Trailer. Again, I'm a kidney transplant recipient. Back in July of 2019, I experienced emergency kidney failure. My kidneys had completely failed. I had what I thought was flu-like symptoms. I had stayed in the bed for quite a few days, and my wife kept begging me to go to the emergency room. And eventually I ended up in the emergency room and found out I was in complete kidney failure. My heart was palpitating as if I had been running a marathon. I had been, like I said, I thought was fighting the flu. I was really nauseated, very sick, very withdrawn from any energy at all. I was just very depleted of any energy at all, and I felt terrible. So I had chronic fatigue, nausea, diarrhea, just all kind of different symptoms. Really swollen with a lot of different things that were going on in my body, swollen ankles. So I had all kind of different symptoms, and I should have known what was going on, but I didn't. And ultimately I was in kidney failure, and I left that hospital in just about 2 weeks and survived the near-death experience. Ultimately did dialysis in center and then progressed to home hemodialysis. And then from there, on a very awesome day on August the 11th of 2020, I received my miracle gift of life of transplant. And it was an amazing gift of love that I received from direct donation by way of Kentucky, where I grew up. Now reside in the San Antonio area of Texas. And I've been rocking life with one kidney. Here I am around 18 months later. So guys, listen, that's a little bit about me. Again, we're going to go ahead and get into this video. If you guys don't already know, I'm the host of Hope with Jonathan. I hope you guys can go ahead, if you haven't already, to hit that subscribe button. And go ahead and check out our website. Check it out at hopewithjonathan.com. We have a free newsletter that we send out different information, just basically information on videos, things like that. We do not share your information whatsoever. If you haven't already signed up to be a donor, please go over and sign up to be a donor right now. You can do that on your phone at donatelife.net. Definitely, if you're suffering with kidney disease, maybe you've just been recently diagnosed with kidney disease, you're looking for support, you really have a lot of questions, please feel free to reach out to kidneysolutions.org. For more great kidney information, you can check us out. It's a brand new website, kidneyconversations.info. We have videos here that are on our channel right here at Hope with Jonathan that kind of give an explanation of what we're trying to do with Kidney Conversations. And please go check us out at kidneyconversations.info. There's blogs on there and lots of great kidney conversation info over there. Go ahead and drop a comment, please. After you watch this video, please drop a comment. Let your voice be heard. We would love to hear from you. And also, guys, if you are definitely watching this, we really appreciate all your support. for the channel. Remember, in no way, shape, or form is this a diagnosis. We definitely want you to contact your team before you would decide to make any changes at all. And really quickly, I'm going to play this disclaimer.
Jonathan is created as an informational, educational, and entertainment show. Hope with Jonathan hosts, guests, partners provide information on the basis of research and personal experiences, and is not to be taken as or implied as diagnosis of any disease or treatment. Hope with Jonathan, its host, and guests and partners recommend and encourage you to speak to your medical team before implementing any treatment or diagnosis found on this show or any product, service associated to Hope with Jonathan.
So there you go, guys. Please, whatever you do, please remember to check with your team before you make any changes at all to anything, whether it would be your medications or any part of your treatment at all. Please refer to your team. Don't go by anything that you hear on this show whatsoever. We really appreciate you tuning in to Hope with Jonathan. Happy to do this video. Want you guys to know what I took when I was battling COVID, when I had a fever. So as you guys know, they want us to, pretty much stay clear of ibuprofen. They want us to pretty much take Tylenol. So the over the counter choice for me with my fever was definitely Tylenol. And maybe you're wondering, well, why do they want us to stay away from ibuprofen? And what are some of the reasons why that they want us to take Tylenol? Well, I'm going to let you know. I'm going to give you a little bit of information. So, as you guys know, ibuprofen and other NSAIDs are basically natural. They block natural body chemicals that normally dilate blood vessels leading to the kidney. So this is what ibuprofen does. Okay, and blocking these prostaglandins may lead to decreased blood flow to the kidney. Prostaglandins is a huge word, so I'm not trying to scare you with that word, but basically, the ibuprofen basically may lead to decreased blood flow to the kidneys. Okay, and so which means that a lack of oxygen to keep the kidneys alive that can cause AKI, which is known as acute kidney injury. So there you have it. That's one of the main reasons why that they want you to abstain completely from taking these NSAIDs, and being, you have to be really careful with taking certain over-the-counter medications, especially when you are a kidney transplant recipient or any organ transplant recipient. But you definitely have to be careful, especially when you are a kidney transplant recipient. So let's go back again and read that again, okay? So basically, the ibuprofen is basically going to block prostaglandins and natural body chemicals that normally would dilate blood vessels leading to the kidneys, okay? So if you're going to take these ibuprofen, it may lead to decreased blood flow to the kidneys. I mean, that's scary enough just reading that. And then it says, which means that a lack of oxygen to the kidneys to keep the kidneys alive. So anything that's lacking oxygen is going to eventually what? It's going to die. So we have to be really careful when we're looking at over the counter drugs that they sell, that you can basically walk into anywhere, Walgreens, CVS, Walmart, anywhere that sells over-the-counter painkillers. You have to be really mindful of what you're taking, what you're putting into your body. You have to be very careful. And so, and as it says here, it says this can lead to AKI, acute kidney injury. Okay, so basically, it can shut down your kidneys if you're not careful. And so if you're living with a kidney transplant, you definitely don't want to risk it. It's not worth the risk. It is just not worth the risk to try to take ibuprofen for any kind of pain. Be careful, be mindful. You have to really read the disclaimers on medication. A lot of people just see that it's a pain reliever. They're going to walk in there, they're going to buy whatever. They're in pain, something's hurting them, and they want to pop something quick because why? They want to relieve the pain as quickly as possible. And my advice to you is definitely first thing, if you're in pain, reach out to your team and find out what they want you to take. So don't waste time trying to research it on your own. Pick up the phone and call your medical team and ask them, say, listen, I need to, I'm in pain. I need to find out what you guys recommend for me to take, and if you're reaching out to your transplant team, they already know you're a kidney transplant recipient, but you may want to mention to them. But if you're reaching out to your just general practitioner or your primary care physician, you need to tell them that you are a kidney transplant recipient. You have to tell them. They need to be aware right away. I'm in pain. I'm your patient. Also, remember, I'm a kidney transplant recipient. I always remind my team. Anytime I pick up the phone to call them, my name's Jonathan Trailer. I'm sick. I need to get in. But also, I hope you guys remember I'm also a kidney transplant recipient. Or if I need medication, I need a refill. Hey guys, listen, Jonathan Trailer, kidney transplant recipient. I do it as a protocol for myself, and just in case that they forget, because I don't want to risk getting, having my kidney fail at all. Okay, guys, this is a gift to me. It was a gift to me. So, definitely want to take care of it. So you definitely have to be aware of what you're taking because you want to keep your kidney safe. So, as you guys know, you want to take Tylenol, and why is Tylenol okay for the kidneys? Well, I'm going to tell you why. Unlike ibuprofen and other NSAIDs, the active ingredient in Tylenol, which is acetaminophen, does not cause damage to the kidneys. Okay. In fact, the National Kidney Foundation, the NKF, recommends acetaminophen as the pain reliever of choice for occasional use in patients who have underlying kidney disease. And guys, if you're wondering about this, I'm going to read this again for you guys. But if you're wondering where I'm getting all this information, all you have to do is Google search this information. It's all on Google. All of this information is for free, and it's right there in front of your face. It's there, it's for everyone. It's so easy to research on your phone. Again, you always need to follow up with your team before you take any medications, okay? But as you're seeing here, if you take the ibuprofen, it's going to cause a lack of blood flow, basically decreased blood flow to the kidneys, which means lack of oxygen to keep your kidneys alive. That can cause AKI, acute kidney injury. Okay, anything with lack of oxygen eventually is dead. Okay, I say, and then unlike ibuprofen for the Tylenol, unlike ibuprofen and other NSAIDs, the active ingredient in Tylenol is acetaminophen that does not cause damage to the kidneys. In fact, the NKF recommends acetaminophen as the pain reliever of choice for occasional use in patients who have underlying kidney disease. So there you go, guys. Listen, there it is right there. There it is right there. And also, a reason why it's mentioning occasional use, I would say there's probably a window of 3 or 4 days. I mean, if you're having to just continuously take Tylenol for a really painful situation, other than maybe a fever reducing, I'm talking about maybe like you're in pain because you fell, or maybe you're in pain because you just have something that is really bothering you. You definitely want to reach out to your team because there's something going on there that you don't want to continue to take Tylenol for. Okay, so your best bet is always to reach out to your team. Your team really should know who you are. It should never be a case where you're calling your team and they're like, I don't know who this is type thing. Unless your team is like, unless your transplant team is like so overwhelmed that they just kind of, have so many patients that sometimes they do forget about who you are. My team, my transplant coordinator, she knows me when I call. I've called numerous times, and she calls me Mr. Trailer, and she knows who I am. I never hesitate to call my team. I don't believe there's a such thing as a dumb or stupid question. But as you guys can hear and listen to what I was saying, when I was battling COVID, my team recommended Tylenol, and you guys now know the reasons why. Tylenol is safe to take for kidney patients. And I've already given you facts. I've already given you the reasons why. So that's what I took. I took Tylenol over ibuprofen, and it helped a lot. It reduced the fever, and I did a lot better with taking the Tylenol. How many Tylenols did I take? I took the recommended dose. That's what I took. If you're wondering for how long I took it, I took the Tylenol for around 3 days because I suffered with a fever for around 3 days. And once that fever completely broke, completely stopped, then I stopped taking the Tylenol. Um, Never did I take ibuprofen. I will not ever take ibuprofen ever again. I will not touch ibuprofen. Matter of fact, um, I'm really harsh on the rest of my family. If I see them taking ibuprofen and they're not even kidney patients, I just tell them, you do not need to take ibuprofen. It's not good for you. And I tell them I highly recommend that you take Tylenol. And so I'm kind of that guy because of my situation. And I just read to you guys, I just read you what the statistics were and the facts right there, the facts. I gave you guys the reasons why. And so if you're wondering uh, what to do, and you're confused, definitely never hesitate. Pick up that phone, give your team a call. But guys, again, I really appreciate you tuning into this video. I hope this video was informative for you guys. Hey guys, go ahead and drop a comment. Just let us know what you think about our videos that we're doing. Really appreciate it. I hope you found it informative. And we really appreciate you. We cannot do this without you guys. So we hope that you guys will take a second and do this right here. Do this right here. Subscribe to the channel. We would much appreciate you. Again, guys, I'm Jonathan Trailer. I'm a grateful kidney transplant recipient, and now I'm the host of the Hope of Jonathan podcast. We share stories of hope, as you guys can see to the left and to the right of me. We share stories of hope. You can thumb through our other videos and kind of see and get a great idea of what we do here on Hope with Jonathan. And I think you'll find some really inspiring interviews. And the reason why we say we share stories of hope, there are so many patients out there that are just newly diagnosed. And if you'll click on some of these videos, you'll find out that we share a message of hope by sharing these stories that people that have overcome kidney disease and now living life with transplant, or maybe they've overcome some great obstacles in life. Some people have ended up back on dialysis, but they're thriving on dialysis. It's just again, guys, transplant is just a form of treatment. Some people are doing amazing with transplant, and some people are out there doing amazing with dialysis. And then we have patients that are seeking that miracle gift of life that we've done interviews for. And we're doing interviews with renal dietitians to spread good kidney disease awareness, and also trying to help people learn how to eat as a kidney patient. And then we're also doing shows as well with nephrologists for prevention and health prevention and things like that for kidney patients, and for people out there that don't have a clue at all. That they may, possibly come across the video and want to get tested for kidney disease. So, we're trying to share stories and a message of hope for those out there. Hope you guys are enjoying these podcasts and interviews. We really appreciate your support. Again, I am the host of Hope with Jonathan, and I hope you guys found this video informative today. Thanks again for tuning in. I'm Jonathan Trailer. Take care and God bless. Take care of your kidneys.